You know that we like to have our poll questions. So we do have one to see if you can answer this one. So Tiffany, I think, is going to put up the poll. And which of these, and you may have attended all of them or maybe just one, which of these had our highest audience, both live and views on YouTube? Was it August 2021, Rethink Vape with EVMS? Was it November 2021, Quit Stories from Former Tobacco Users? Was it October 2022, Virginia Cannabis Control Authority? Or was it September 2023, Back to School and Vaping with VDH TCP? So which one of these would you think had our highest views? Another second or two. Put your choice in there. Drum roll. And let's see what you said. So 43 said October, Virginia Cannabis Control Authority. That's a very good guess. Not the correct one. The correct one is the August 2020 Rethink Vape with EVMS, right? That had over 138 views. All of these had over 120 views, but that had the highest. Vaping, is just taken over a lot of our program and our thoughts. And I thought I saw Paul on. He's not on my screen now, but I think I see him on. He's the one. Paul Harrell is the one that came and did that presentation. So thank you for that. Thank you to all of our presenters. And we thought what would be fun too, if you were one of our presenters, just put it in the chat, your name and what your presentation was on, so people can see what we've done over the years with our presentations. So we're going to go ahead and get started. I think I've done all I needed to do with the introduction, but I'm going to turn it over to our program manager, Mark Bolt, and he is going to kind of give an update about our program and where it stands as of today, August 11th. Mark, I'll turn it over to you.
Thank you, Gina. I think I'm waiting for the first slide. Good morning, everyone. I was hoping not to talk about the elephant in the room, but instead I have to report that although we have submitted our CDC application for a one-year extension, which would be from April 25th through April 26th, for CDC funding, we are still waiting for final approval and the release of any funds that may have been temporarily frozen by the White House Office of Management and Budget. Due to the uncertainty of federal funding, particularly beyond April 2026, the Tobacco Control Program, along with other VDH programs, have submitted proposals for general revenue funds to senior leadership at VDH. Senior leadership will go through the process of reviewing these proposals and select proposals to forward to the Secretary of Health and Human Services to analyze. Ultimately, if anything does show up, it will show up in the budget that the governor releases in December. So I really appreciate, our whole team appreciates all the support from our national partners, from all of you for tobacco control. Your advocacy efforts, I think, make a gigantic difference. In the meantime, we are using carryover funds to implement our strategic action plan to support the four major goals that have stayed the same: to prevent youth from using all forms of tobacco, to help people quit, including adults, young adults, and youth, to eliminate secondhand smoke, and I should probably say aerosol at the same time, and to reduce tobacco-related disparities. Our regional coordinator structure has kind of evolved to a centralized structure with subject matter experts in particular focus areas of work. And why we have done this is to maintain and expand our partnership network to expand messages on the harms of all tobacco products and the benefits of quitting, to increase adoption of sustainable tobacco control policies, and to enhance support for evidence-based prevention and youth and young adult cessation. In my role, I will continue to manage the CDC grant, facilitate staff strategic planning process, and identify opportunities that align with our work with other statewide initiatives and identify alternative sources of funding, which I think is critical to the sustainability of the tobacco control program long term. Our new position, our youth and young adult coordinator, Tiffany, will provide resources to our schools to support evidence-based policies that prevent use, encourage quitting, including, importantly, alternatives to suspension policies, and provide support to colleges and universities on strengthening tobacco campus policies. In Gina's new role as Community Impact Coordinator, she will engage health districts and localities in supporting tobacco control policies that reduce tobacco use and disparities. And Nicole, as our cessation coordinator, managed our Quitline contract and educates partners on Quit Now Virginia services, and importantly, supports healthcare systems to systematically refer patients to tobacco treatment services. Sarah, as our policy and outreach coordinator, will coordinate all of our statewide media and communications to build awareness of the harms of tobacco, benefits of quitting, and works with our VDH internal and external partners to help expand statewide services to tobacco control initiatives. Kyle Jerome, our epidemiologist and evaluator, will continue to facilitate our grant reporting, analyze data, and assess the program effectiveness to inform strategies that reduce tobacco use and improve public health outcomes. Admittedly, future staffing may change depending on funding, but I can assure you that VDH will do everything in its power to continue prioritizing the quit line and being a resource for implementing sustainable tobacco control policies. I know that's quite a bit to cover in a short period of time, and I'll be happy to answer any questions at the end of our webinar. But for now, I will pass it over to Nicole to share today's agenda.
Hi, good morning, everyone. Thank you for joining us. Great to see familiar faces from the past and all the speakers and everyone talking in the chat of how they've been involved. So again, we're so thankful to have you guys here. So today we will cover these topics. So we'll go over cessation prevention programs. Next, Tiffany will go over policy initiatives. Gina will cover resources for schools. And Sarah will kind of round it out with coalitions and, what our next steps are and how we're going to think through the next few months or year or so. And then again, we'll end with our questions. So again, feel free in the chat if you have any comments or questions. We'll have some time at the end to cover everything. So we can go ahead and get started with cessation prevention programs. So of course, the first one we'll be talking about is Quit Now Virginia. So I hope everyone has heard of it. If not, we have to talk. So of course, Quit Now Virginia is a free service for everyone 13 and older in Virginia can utilize to quit any type of tobacco or nicotine product. So you can call, you can go online. We have an app now, so you don't have to talk to a real person if you don't want to be on the phone. It's free, confidential, 24/7. Talk with a quit coach. You can, after registration, they'll talk to you about if you're eligible for free nicotine patches or gum as well. Again, like I said, there's an app. You can do one-on-one calls with your quit coach, and there is actually an option to do a group session as well. So if some people, they want that support, that peer support, kind of talk through things, that's available. And of course, there's an online dashboard in addition to the app as well. And the next slide, we'll see just one of our many materials we have online. So there's many Quit Now materials online that you can use for your patients to share in the community as well. In addition to Quit Now Virginia, on the next slide, we'll see another service we have, another program that's geared more towards vaping. So we have Live Vape Free. So there we can go. Perfect. And so that is more geared towards around vaping specifically. So it's resources and it's broken down for teens, young adults, and their support circles, which include parents, coaches, educators, physicians, anyone who really has that more one-on-one kind of relationship with youth. And so that's online on vapefreeva.org. And you can share that with schools, as Tiffany has done as well, and within your community. And then next, we have We Can Quit from VCU Massey Cancer Center. So it's a free service as well. You can connect it with Quit coaches. So they have a few on staff, also on the phone. They have these great Massey on the Move vans. I think there are two of them. And so they're great. They can go meet you at a community event. If you have a health fair locally, they can meet people inside the van. They have a cool overhang and a TV that swings out so they can show and educate more people as well. And I think we have Michael on the call today. Let me see if I see his face, or anyone from Massey as well. But we do have the contact information, engage Massey at vcu. Engage Massey at vcu.edu, or you can call as well. I'm sure there's a website, and just get involved. And so just another community resource in Virginia as well. So I don't know if I see Michael on here.
Hi,
So,
no, but it's Jarrell.
what's up? Hi.
Hi, how are you? It's nice
Oh
to
my
see you
gosh.
again.
Great to see you.
Yes, sorry I'm off camera today. We're out and about. But yes, we can quit. We still have that going on. So you can get 5 free sessions, like she said, with a quick coach. We are usually out at community events. We can definitely share about the programming. So if you would like to find out more information about that, you can reach out to engagemassey@vcu.edu. I'll drop my email in the chat as well, just in case anybody wants to connect as well. As you know, I'm usually out and about somewhere everywhere. I'm pretty sure some of you have seen me somewhere anywhere. So if you'd like to talk more about it, please just reach out. We would love to discuss something. Thank you so much.
Great. Thank you, Jarrell. Yeah, Jarrell's great. We worked at, I think, an event in Newport News. So it was
Yes, we
very
did. We had the
busy.
most fun.
Yes, it was so fun. Jarrell's great. Oh my gosh, such a great personality. And bring people in and talk to people and getting people signed up right there and then. So please connect with Jarrell and Michael and their team. They're wonderful. So we have our next program we have is the X program. So a lot of you, I'm sure, have heard of this with Truth Initiative, Mayo Clinic. The X program is kind of, you've heard of it, but it's kind of changed recently. So anyone, if they're thinking about quitting. It's for 13 and older. So again, Tiffany has shared this with schools around the state as well, just another resource to complement Quit Now Virginia and our Live Vape Free. So you can text 88709 to X program, and there's a website. And then parents as well, if you want more information how to talk to your youth about vaping, you can text quit to 847-278-9715. So that's great. And they'll offer 24/7 support and daily text messages with daily support and tips, things like that on quitting and staying quit. And of course, we have smokefree.gov, and they have specialty pages as well. So we have for veterans, for teens, for women, and also in Spanish. And they also have their app, the Quit Start app, to help people get more tailored tips, motivation, and getting over their challenges as well through the day. And I will pass this on to Tiffany to cover our policy initiatives.
Thanks, Nicole. Can everybody hear me? Okay, thank you. Hey, everyone. Thanks, Nicole, for going over some of those great programs. If anybody's interested in hearing about some of those evidence-based youth programs, please feel free to connect with me. So I'm going to go over some of the bigger policy initiatives that we felt that are making a huge difference, and we hope whether we are here or maybe not here, that will be continued. So one of the best ways that is evidence-based is leveraging taxes for prevention. So currently Virginia has a 60-cent tax on cigarettes, and in 2021 they allowed counties to implement it up to another 40 cents, so a total of $1. So, and then the counties get to choose where these funds get used. So besides bringing counties much needed revenue, this is evidence-based strategy to help people quit and even to help not even start using tobacco. So increasing the price of cigarettes is an effective policy intervention to prevent initiation of tobacco use, promote cessation, and reduce the prevalence of intensity of tobacco among adolescents and young adults. I just want to quick point out the CDC did find an increase in excise taxes in Massachusetts. For example, when combined with an anti-smoking campaign, it produced a 19.7% decline in cigarette consumption per capita 4 years after the tax increase was initiated. So I just want to point out that young people are particularly sensitive to tobacco product price increases. So increasing the unit price for tobacco products is an effective method for reducing tobacco use among young adults and adolescents. And the largest impact on cigarette demand for use is the perceived price of cigarettes. So before I go to the next slide, just real quick, some counties that have been successful: Richmond, Fairfax, Blue Ridge Health District. And these funds that they've brought into the county can be used for prevention efforts like coalition work, tobacco treatment, community health workers. So a lot of different ways. So connect with me and I can connect you with other people in counties that have been successful. Okay. Okay, so another wonderful initiative going on in Virginia is the House Bill 947. So any locality by ordinance can regulate the retail sale locations of tobacco products, nicotine vapor products, alternative nicotine products, or hemp products intended for smoking. So this is another evidence-based strategy. So limiting vape shops near schools to reduce exposure to pro-marketing and advertising and physical access to products. Next slide, Nicole. So some of the work that is going into this, Morgan Snell, she's an assistant professor at the Department of Health Policy, School of Public Health at VCU. She's been putting into place resources for communities to help them be successful with this. So she's doing this through building the evidence base, engaging local experts, and creating and sharing the toolkit. So she's really making sure that communities can make informed decisions and be successful with implementing House Bill 947. So make sure to connect with her and she'll help your community leaders get involved and do this the right way. And I know Morgan was possibly going to be on, but she did have to step away. Morgan, are you on right now?
I am. I'm here.
Oh, hey, Morgan.
Hey, how are you? Thanks for having me, everybody. I know that many of you were on the call recently in the spring when we talked a little bit about this project. And one of our recent wins that Sarah Burkhead could talk about as well is we got to provide some information to the City of Richmond Planning Department through this initiative. And on July 28th, the City Planning Commission approved an amendment to the City of Richmond zoning ordinance so that now tobacco retail outlets can't be located within 1,000 feet, or at least new outlets of a school, a child daycare center, a public park, a place of worship. And so as far as I'm aware, that's the most comprehensive set of youth-oriented locations so far in Virginia that a locality has chosen to address in terms of where they don't want new tobacco retail outlets to be located. They also have implemented a policy that new outlets can't be located within 1,000 feet of another existing tobacco retail outlet. So this is really exciting. They did define who's subject to these commercial zoning requirements, and I'm happy to talk about that in more detail if anyone wants to email me or get together and has a particular interest in this topic. But it's very exciting for us to see Richmond lead the way and to have provided some evidence for them as they were weighing adopting a change to their ordinance.
That's awesome news. Thank you, Morgan. That's a great win. All right. Well, finally, another amazing partner. I'll talk about Y Streets Share the Air. I think we're all pretty familiar with this, and we had them present, I think, last year as well. So in Virginia, we want to keep this momentum going. So again, we're asking for your help. We're not just here to tell you about these resources, but hoping that you will take this information and bring it out to your coalitions, bring it into the community, bring it to your park directors, keep this going, because we just can't do it on our own. Tabitha Magabet is Y Street Share the Air program supervisor. She has been instrumental in helping create a healthier tobacco-free environment for our youth. We now have 31 parks that have voluntarily gone tobacco-free with the help of them, getting free signs and media and resources. So with your help, with everybody on the call here today, we can get more parks involved. So connect your park director to Tabitha and tell them why your community wants this. Tabitha, are you on? You want to, if you're on, you want to hop on and add anything or just introduce yourself?
Yes, good morning, everyone. My name is Tabitha Magabet. I am the program supervisor for Y Street, which is the Virginia Foundations for Healthy Youth's largest statewide teen initiative. Our Virginia teens are doing such amazing work around tobacco prevention efforts such as the Share the Air campaign. It started back in 2019, and I also want to share the same sentiments, Tiffany, that VDH has played an integral role in helping us to make these connections with park and rec departments across the Commonwealth. Our goal is to turn our entire map, the branded green that you see here on the screen, and thus far we have been able to successfully partner with 31 localities. With more to come. So as Tiffany mentioned, we could really continue to use everyone's help. Please feel free to reach out to me. My contact information is right here on the slide. We need any and all help to kind of reach and create these inroads within the park and rec departments, meeting with park directors and their staff and board of supervisors, city and town council. Our youth are the ones that are leading these conversations. So please feel free to reach out to me so that we can continue to make this headway and turn the entire map green. Thanks, Tiffany and VDH.
Thank you so much, Tabitha. All right. Well, I am going to pass this on to Gina. And Gina's going to talk about schools and the work we've been doing with schools. Gina?
Thank you, Tiffany. As everybody knows, their work with their youth and young adults is so important. We all know that the age most people start smoking or using tobacco is before 18, right? So 9 out of 10 start using nicotine before 18, and then the 99% use before age 26. So we know the population that we really need to start working with early. And I think, as you just heard from Tabitha, one of our strongest partners or the leader in youth prevention is Virginia Foundation for Healthy Youth. They are, I know Michael and Lisa, I think I've seen you on the call today. They do really amazing work throughout Virginia and are one of our strongest partners. One of their research projects that they are funding is called AVERT, and that's assessing vaping exposure risk for teens. When you see the slide up here. And I encourage everyone to go on the website and really kind of look and see what this initiative, this tool is all about, because it's a lot of information for school advisors, health providers in the schools, administration, parents, behavioral health providers, and teens themselves. So you can go on this tool and really kind of quickly assess the teen's level of risk for vaping use and addiction. And you can pull out resources based on that risk. So you can, tell your schools about this resource. You can connect K through 12 schools with this partner. But the website is up on the slide, and just go kind of play around with it, right? What I did is I clicked myself in each one of those categories, whether it's a school administrator and whether the teen was vaping all the time or just started vaping, to find out the list of resources. So play around with it, see what's out there. It's a wonderful resource tool funded again by the Virginia Foundation for Healthy Youth. The researchers that are doing this have been in this field for so long. Paul Harrell, Kelly England, Amy Paulson, Hannah Savage, Ann Lassiter, and Natasha Seriman. So, so much experience and expertise has been built to put this resource together. I encourage you to use it. I know Hannah is on the call today. Paul is on the call today. And if I have missed anything, if you want to just jump off and let me know if what I covered is adequate, or if you have any other additional information to provide on this.
Hi, Gina. Yes, thank you so much. That's a great summary. Yes, this is a great way to quickly assess a teen and connect them to a resource based on their level of need. We're also working with schools currently to help them come up with some better approaches to addressing vaping and substance use in their schools. So if you work with a school system in Virginia and who might want to help us or work with us on this project, please also connect them with us as well. You can email us by the email that's featured on the slide, and we would love to connect with you. Thank you. I don't know if Paul, if you had anything else to add, but
Great.
Yeah, thank you so much. Very excited about being able to connect with people and be able to share this tool. Thank you for the opportunity, and look forward to connecting with more folks to come. We're currently working with Norfolk schools, and we've surveyed schools throughout the state, and we're continuing to connect with folks. So thank you again for the opportunity, and look forward to connecting further with people. Thank you.
Thank you, Hannah. Thank you, Paul. Such good work going on. So, in working, we work with the lower education, the middle school, the high schools, but we also have an initiative that's really targeted toward our higher education colleges and university. And this has been an initiative that has been going on for over 5 years. It started with the leadership from Dr. Anderson and Dr. Femmler from UVA and VCU. Really put together this initiative, put together a committee that can really bring together higher education colleges and universities to work toward tobacco-free campuses, right? That's their sole focus here, is to really improve those tobacco control policies with Virginia colleges and universities. And we have a lot of work to do, as you'll see in just a second. I will show you, since I'm on this slide, Lindsay Hauser is pretty much the lead on this entire initiative and has done wonderful work over the past 5 years in really putting this together. Without Lindsay, I'm not sure any of this would have really taken place and gone as far as it has. So kudos to Lindsay, and I'm going to ask her if she wants to add anything right after I go over the next slide. But there are several things that this initiative is kind of putting in focus. We have annual summits. So anyone on this call that is familiar with a college, is on a college board, has a young person at a college, just has a coalition in that area, wants to get involved with the college, contact Lindsay, because this initiative is so important to when our high schools are tobacco free, and now they're moving into a college setting, and these college settings really need to be tobacco free as well. But they are not. Very few of them are. We have a policy dashboard. I know Kyle's on the call as well. Put together a remarkable dashboard that shows the grades for all of our colleges. So each college was given a report card and kind of given detail about how you can improve your policy, where your policy stands now, and what you need to do on the college campus to really improve it. So going on the dashboard, you can see all of that. You can see what their grades are now, what their grades were last year. The dashboard launched 2024. And Kyle just updated it this year. So it has 2 years worth of data there. You can see that we have, if you go on the dashboard, and I encourage you to do so, we have 3 A's in Virginia, 2 B's in Virginia, 18 C's, 13 D's, and 5 F's. So lots of improvement, lots of work to be done. But over the past 5 years, there has been remarkable movement with these colleges. Remarkable movement, initiative that really gets people's attention, and we know that this really makes an impact with our young people. So we do the report cards. We provide technical assistance, the Tobacco Control Program staff. We work with the colleges. We want to make sure they have committees on the ground. We have student engagement, administration engagement, funding if possible, if they're able to apply for that. So we encourage you to get involved with this. Lindsay, if you're on there and want to kind of jump off and see if I've missed anything, or just encourage people to join your committee, that would be wonderful.
Yeah, thanks, Gina. We're always looking for new members for our ETU Virginia initiative. You don't have to be associated with a higher ed institute, but we look for others who might have ability to engage students or help with the coalition building side for the different colleges and universities. And I cannot say enough to the technical assistance that VDH has provided over the years as well. We had a huge win last week. Sarah and Gina reached out and let us know that in Sydney just went tobacco free. So yay, we'll see our letters change a little bit on our dashboard, hopefully in this next coming year when we do our annual cycle of policy reviews, but it's happening. We're starting to see that groundswell of the colleges and universities moving towards stronger tobacco-free policies. So hopefully y'all will join us in this initiative as well, and we'll see you on our quarterly calls as well.
Great, thank you, Lindsay. And another partner that kind of flows right into the tobacco-free colleges is the Truth Initiative, right? They do fund different colleges to go tobacco-free. And they've done that since 2015. They have funded more than 235 colleges and universities to adopt 100% tobacco and nicotine policies. They just finished an application process in 2025 in January. And the next application opens in 2027. So we as a staff will be encouraging colleges to apply for that funding come January 2027. This current one is for 2 years. It was up to $20,000. And it goes a long way to really making the initiative a priority on the college campus. You can really engage students, you can engage administration, you can use the money for an intern to really engage the population on the campus. So I encourage anyone to really put this information out there. There have been 7 Virginia grantees over the past few years, and you can see the list right here. Only one has adopted 100% tobacco-free vape-free policy, Virginia Union University. And I must say, as you all know, this takes a while, right? And it's not a probably month-long process, half a year process. It's a work in progress. So we work with the colleges to move it from where they are now and maybe just improve it a little bit, and then hopefully go 100% tobacco free. So I encourage anyone that has a college in mind to look into this funding. And I am going to turn it over to Sarah now to talk about coalitions in Virginia.
Thank you, Gina. So as already has been stated, when we were a little concerned that we would be really bare bones staff come October and decided to have our last tobacco-free Tuesday, we envisioned this as a way of sharing examples of the tobacco control that's already going on that you all have seen on our tobacco-free Tuesdays, but just really highlighting how much work is happening in the communities and really encouraging you all to think of the best ways that you can match up, depending on the work that you do or your passions, that you can match up and be a part of all of these initiatives. So the first one of the coalition work that we wanted to talk about is the Tobacco Free Alliance of Virginia. It's our only statewide coalition that's solely focused on tobacco. And it's a great place to connect with local, statewide, and our national partners as well that work on tobacco and nicotine prevention, cessation, and policies. We have a communications subcommittee, membership, and legislative subcommittee that are really the ones that are leading these efforts for TFAV. And we just can't stress enough that how much we want you to get involved and come be a part. Membership is free. These slides will go out to everyone who's registered. There's a form to register, and then that way you're added to our newsletter. Unfortunately, we had to take our website down, but it will be back up soon. But I have that bookmarked for your slides as well. And Dr. Hong Zhu is our current chair. I don't know if he is on. I'm sharing my slides, so I can't see everything. But Hong, if you are on. Well, if anyone has any questions, you can reach out to me as well. And we would be happy to get you involved with TFAV. Stikova is another one of our statewide partners. That's a coalition of coalitions. And so it's a great place to find out who in your local community is working on not just tobacco, but also reducing and preventing all substances. So substance use and related risk factors in Virginia. There's over 50 organizations that represent communities across Virginia. Um, it is more than tobacco and vaping, but those topics do come up and are obviously connected to other substances as well. So I think we have Travis Fellows on today. Travis, if you want to come off mute, say hello, and also put your contact information in the chat, that would be great.
Sure. Thank you, Sarah. I always appreciate working with you guys. I will just kind of emphasize, the coalitions we represent, they focus on so many different issues, and not all of them are focusing on vape and tobacco currently. But I can also say that for a lot of folks, that's probably a funding thing. I'm hearing a lot about grants today. So if you are an organization that has funding and you're trying to get into a community, you can probably connect with the local coalitions, and I'm sure you can find some support there. But I'll drop my email in the chat. We're always open to conversations. Thank you.
Thanks, Travis. And we also wanted to highlight CACV, the Cancer Action Coalition of Virginia, which is Virginia's state cancer coalition. Over 25 years ago, CDC created the Comprehensive Cancer Control Program, which provides funding for every state to develop a cancer plan as well as create a coalition. And so obviously tobacco is connected to a lot of cancers. It is the leading cause of cancer and deaths from cancer. And so they're one of our partners that we really value the work that they're doing in the community. They have a conference coming up in September. I encourage you to attend if you are able. And to really go to their website and to learn more about CACV. And I believe we have the executive director, Jessica Deering, on the call today. Jessica, if you're on, if you want to come off mute and say hello.
Sure. Hi, everybody. I think Sarah did a great job explaining who we are. Just as if you don't know, our first section of the cancer plan is prevention, and the goal 1 is related to tobacco control. And so we welcome anyone to help our efforts and work together. And we have appreciated our partnership with the tobacco control team at VDH. And she mentioned our conference. I'll put a link in the chat, but it's in September. So we'd love to have you join us there. And feel free to reach out if you want to learn more about the coalition or the cancer plan. Thank you.
Thank you, Jessica. And so we really want our team to help amplify all of these local, statewide, and even national efforts that are going to help Virginians to live tobacco-free. So that's what we hope you take from this Tobacco Free Tuesday is our efforts to work together. We have a couple of resources and things that I just want to remind people about. One is our VDH Tobacco Control website, where you can find an overview of our initiatives. You can find the digital copies of all of our resources that we would love for you to spread throughout the community. We have new one-pagers. I'm not sure if everyone knows that, so we'll link to those. They're in English and Spanish on a variety of different topics, and we're expanding our one-pagers as well. So we have an example there of tobacco and COPD, but those are a great resource if you have health fairs or work with patients and can hand out a fact sheet related to what you're talking about. We also are always interested in what you would like to see for our one-pagers, so please let me know. You have access on our website to the latest tobacco data that we have on the VDH website, and as Gina already shared, the Eliminate Tobacco Use Dashboard as well. So please visit that site for the Quit Now Virginia and Vape Free Virginia resources and any up-to-date information about our program. And then I also want to just celebrate all the work. These were just highlights, but we are so lucky to have such strong partners that are doing such incredible work throughout Virginia. And so this was just, we took from the TFAB website, but these partners are at TFAB, but they've also been a part of our Tobacco Free Tuesdays over the years. And they're really doing wonderful work. So we hope to continue to amplify the work that you're doing, to add to it, to add to the momentum of tobacco control. So no matter what our funding and future looks like, we can be a part of all the good work going on. So again, just to recap, we hope you join TFAV, sign up for the CCOVA newsletter, join CACV. All of this will be in the slides, and stay in touch with us as well. Use our resources. We may not have Tobacco Free Tuesdays, but we are available for technical assistance. Your tobacco control team would love to meet with partners on tobacco control best practices. And keep an eye on our newsletter, read the newsletter, scan it. Instead of Tobacco Free Tuesdays, we may do some targeted workshops. And so those will be highlighted in our newsletter. And of course, you can always reach out to any of us individually. Our contact information is on that TCP website, or we do have our generic email at tobaccocontrol@vdh.virginia.gov. So thank you for this portion. I think I'm going to come off my screen and open it up to see if we have any questions or discussion.
Great, Sarah. I've been monitoring the chat. I don't think we have any big questions. Oh, okay. So Jane just had a question. Thanks, Jane. For Mark, from my understanding, is it that the CDC oath has been eliminated? Is that correct? If so, how are the grant applications for the 25 through 26 year being reviewed, administered, etc.?
Jane, that's a great question. My understanding is that staff have not been completely eliminated, that they're, when we submit our application, that is being reviewed, but we have no notification about our own separate liaison to the CDC. So, I mean, I think that that's a concern in the sense that they may not be monitoring things quite as carefully as they have in the past. But like many of these things, we sort of have to stay tuned in terms of what's coming down the pike. But as soon as we know anything about that or anything more about funding, we will let everyone know here. But it's sort of constantly evolving, and we always say what we know today, because tomorrow may be completely different.
Mark, for that summary. And Carolina said she missed the first 15 minutes. So we're still here. Luckily, we did receive, an opportunity to apply for funding. It's not officially finalized yet. It's just going through that process. So we did submit an application to receive funding until the end of next April, for sure. So we'll be here. And you'll get the recording as well to kind of see more details of what Mark talked about. But, we are exploring other funding opportunities. And so Quit Now Virginia is still here. We still have our resources. Again, if you have any questions, feel free to reach out. Continue to refer your clients, your patients to the service as well, please. There is a free online referral portal. If you have questions, reach out to me. It's pretty easy when you go on. It's like 3 clicks. Actually, I think it's 2 now. And they're also trying to streamline the registration portion, because I know that's there's a ton of questions that they had to ask, but they're trying to break it up and don't lose people, because I know it's a lot to answer on the first go around. They're trying to make a ton of these improvements just to make it easier for people to utilize. So again, we still have Quit Now Virginia. We still have our website. We still have the service going on that people can connect to Quit coaches. We hope soon to amplify the services we can provide right now. So we're still here for now and hopefully for longer. But we just wanted this opportunity today to share other resources, to prepare and, complement what we can do right now, just in the future, since we're not sure exactly how long we'll be here. We just wanted to amplify our partners, and it's great to see everyone who logged in today, everyone we've worked with in the chat and talking about how they've been involved with not just our Tobacco Free Tuesdays the past 4 years, but also, just in general, even before that. So again, if you have questions, feel free. About 10 minutes left. And talk through things, or if you have questions that you want us to answer, or things that we've missed that you want to talk about, or share your program as well. We try to share more statewide resources, and some are based out of communities. But there's a lot of great resources that are available and that we've worked with and partnered with, and we want to share that as well. It's great to see everyone's face this morning as well on partners. Anyone from the team have anything to add as well? No worries. And again, if you're not part of our newsletter, please sign up. That is where we will share any news, any updates that we have, any of those targeted workshops that Sarah mentioned that we might do. We'll share that all through our newsletter. And just be sure you're part of our monthly newsletter. For TFT, it's a separate newsletter, but all of our the monthly newsletter has more of a reach. So we'll share more updates on them. And we have all of our resources online as well, the different one page that Sarah talked about that have been updated, materials that you can share to patients. What else?
Well, as we wait to see if anyone has any last minute questions, I'd love to actually ask while you all are on the call if there are any targeted workshops that you would be interested in. I am not going to share these results. These are all anonymous, so please just answer honestly. We don't want to go through the effort of putting together these workshops if people, they're not helpful. And so we came up with a couple of our top ideas for these targeted workshops. And if you have other ideas, just reach out to us. We would love to help provide you with information to build that momentum around these areas. So we have Quit Now Virginia, best practices for referral sites, behavioral health, both tobacco cessation and tobacco-free policies at our behavioral health organizations. Integrating Quit Now Virginia into the electronic health records, electronic medical records, and healthcare systems. You've seen a lot about tobacco-free higher education, but if workshops would help people move them to apply for those grants or to work on those policies. Or how about our K through 12 schools, best practices to prevent and stop youth vaping and other tobacco use. Tobacco-free work sites, implementing tobacco-free policies at work sites. Continuing to work on Virginia casinos and advocating for smoke-free policies across the state. So please just let us know anything that you may be interested in attending. I'll turn it back over to you, Nicole, but I'm going to give it, they're still coming in, so I'm going to give it another second here.
Yeah, definitely. Thank you, Sarah, for sharing that. And again, all of our recordings for the past TFTs are also on YouTube, on the TFAB's YouTube. So if there's something that people talked about on here, or they talked about they were a speaker and you're interested. So like the Avert team, they are highly viewed. If you missed it and you're interested in what the hype was about, you can go online and watch the recording as well. But again, reach out to Hannah and Paul. They're great to work with as well. Definitely great resource, great motivation, giving momentum to things like that. Mm-hmm.
Nicole, before you pass it on to Gina, I do just have one thing to add. Just really, this would be the best place to say, but I just want to say I recognize a lot of people on here from coalitions, CSBs, and health departments, and thank you for supporting this work and supporting me. It's always made me feel really good about when I was supporting the Northwest region. So I just wanted to put that out there. Thank you. Gina, I'll give it to you.
Thank you, Tiffany. And thank you, everybody, for joining us today. As you can see, we have so many good programs going on, many great initiatives, great partners, and more to come from the Tobacco Control Program, right? So when I started out and I said, this is where we stand as of as of August 11th, 2025, that's what I mean. This is where we stand as of August 11th, 2025, right? But we do have very high hopes that we will be here until April, and we will continue this work. And there's so much going on. We're so happy to work with you. Call us, get involved. I think there's enough that was shared today that everybody can just feel very proud to be in the tobacco control in Virginia right now. The momentum is very strong, and I think it will just continue. This is not the end of anything. This is the beginning of so much more that we have to do in Virginia. You're all so a part of that, and we really appreciate your efforts in tobacco control. So I am going to give you 4 minutes left of your day. Enjoy the rest of summer. Fall is quickly approaching. School has started back in my area this week. Not happy about that, but it has. I will be happy for cooler weather, some pumpkins and apple picking. So go out and enjoy it, and we will talk soon. Thank you all so much.